some of you may have experienced something called Raynaud's nipple. Now, this is where you get Raynaud's of the nipples, and it's worth pointing out that you can get Raynaud's of any extremity. So we do see it in the ears and the nose, as well as the hands and feet. Obviously, affecting the nipples is pretty unique to women, and it can be a real problem in breastfeeding a baby, where you get these very painful, blanched nipples. They go almost cold and dead when you're trying to breastfeed, and it's probable that it's a manifestation of your Raynaud's, but it's being triggered by the excess stress that you're under with trying to feed a baby. It can also be precipitated by going out in the cold. Some ladies who get it during breastfeeding find that it's misdiagnosed as thrush or infection of the nipple, because it's quite common, particularly when you first breastfeed a baby before you get the hang of it, for the nipples to crack, and that can allow infection in. And sometimes people are given repeated courses of antifungal treatments and antibiotics, but actually what they need is treatment of their Raynaud's. In terms of managing Raynaud's, there are a few things that we recommend. I personally recommend ginkgo biloba. It's an over-the-counter remedy. It can improve circulation, and it's usually well tolerated. A lot of people will try omega-3 and fish oil treatments, and again, there's a little bit of evidence supporting those. Obviously, it's important to be practical and to avoid the cold and avoid exposure to cold. And when you're thinking about staying warm, you must think about keeping all of you warm, not just your hands. So you need to keep your core warm so that your core doesn't start pinching the blood to warm you up. So that means things like thermal vests, etc. And I'm a great believer in people going off to ski stores. You can buy some amazing undergarments and stuff now, and layering, wearing thin layers close to the skin and fluffier layers further away to trap warm air around yourself. If that's not enough, then you can move on to taking medication. And the most used medication in the UK is probably nifedipine. And nifedipine is a very old-fashioned blood pressure tablet, which almost as a side effect dilates up blood vessels. And it's one of a group that we call the calcium antagonists. We do use other blood pressure tablets as well. The drawback to all of these, though, is that blood pressure tablets inevitably drop your blood pressure. A lot of women with Raynaud's have fairly low blood pressure anyway, so they can make you a little bit lightheaded and woozy when you first take them. So if you're given a new tablet for your Raynaud's, top tip is to always take it at night when you start off, just to make sure you can tolerate it well. Gabapentin is an interesting drug. It's a nerve pathway blocker, and we know that you do get nerve involvement in Raynaud's. So again, there's a feedback loop in a normal person whereby the nerve endings in your peripheries send messages to shut down the blood vessels. And using drugs such as gabapentin, which can block those nerves, can actually help. And we also use a whole range of other drugs, things like fluoxetine, and even sildenafil, which some of you may have come across under its trade name of Viagra. And sildenafil was obviously, it was originally designed actually as a blood pressure drug, and then incidentally found to be good for erectile dysfunction. But it's really good for Raynaud's. It really dilates up the blood vessels very, very well, and it can be a very effective drug. The main drawback to it, again, is its effect on blood pressure, where it drops the blood pressure and can make you lightheaded.